and our beloved Guru. I give tribute to our beloved Guru, Dr. Praful Vijekar sir. Myself, Dr. Shilpa Sanjay Raut from Akola. I am a student of sir since 2003. So I have been with sir. I learned a lot of things since 17 years from sirs. In these years, I learned a lot of things along with homeopathy. I learned many things, how to behave in a family, how to behave in Good morning, one and all, and warm welcome to all of you. First of all, I give tribute to our master, Dr. Samuel Hahnemann, and I give tribute to our beloved Guru, Dr. Praful Vijekar sir. Myself, Dr. Shilpa Sanjay Raut from Akola. I am a student of sir since 2003. In these 17 years of my life, I learned a lot of things from sir. Apart from homeopathy, sir have helped me in my personal life. Sir show a way, sir show a path to me in my life. Apart from homeopathy, I learned many things from sir, such as how to behave in a family, what is the role of mother, how to behave in society, and how to behave as a physician in the clinic, how to behave as a human being, what is the purpose of your life, what is your importance of your existence. I learned a lot of things from the sirs, and I have seen only one person in my life who have won the heart of million and billion of people. That is nothing but Dr. Praful Vijekar sir. I am very thankful to God that he is my guru. Now, today, this is the first lecture of theory of acute. Today, I am trying to explain the teaching of theory of acute. I will try my level best. We have learned the theory of separation. The theory of separation, the chart of theory of separation is based on, they have a scientific base of embryology. Like this, theory of acute have a base of Panchatattva. For this, actually the theory of acute is a chart of only one page, but sir have taken lot of efforts to prepare this chart. Sir have learned, sir have read embryological book, anatomy book, physiology, pathology, biochemistry. Even sir have read the Vedas, Puranas and all. And sir have done combined study of all these books. And from this, sir have prepared a chart of acute. The chart of acute is based on Panchatattva. The Panchatattva, the man is a part of universe. Everybody knows that. And man is made up of Panchatattva. And the Panchatattva, man is made up of Panchatattva, which is accepted by the Hindus, by the Muslims, by the Buddhists. And all over the world, it is accepted that man is made up of Panchatattva. So sir have prepared a chart according to giving importance to this Panchatattva. It is prepared on the basis of activity, thermal, thirst, and mental axis. So this 5 Panchatatvas are ether, air, water, fire, and the earth. Ether represents the cosmic energy. The cosmic energy controls the activity of the world, and naturally, man is a part of the world. So, the cosmic energy controls the activity of the man. That's why ether represents cosmic energy, that is proportional to the activity as it controls the activity of the human being. Air represents the mind, water represents the thirst, and the fire represents thermals, and earth represents body. So by considering all these things, we prepared a chart of acute, and when we considered this Panchatattva, we considered as a these are the constituents of the man, and when we considered all these constituents of man, it acts as a holistic, or we can say that we consider man as a whole, and when we consider man as a whole, it works holistically and it gives wonderful results. It gives miraculous results in acute emergencies, and in even incurable cases. When the indicated remedy is prescribed on this basis, consider man as a whole, acts miraculously, and along with this, not only it acts as a miraculously, but it also observed the Herring's law. In each and every cases of acute as well as the chronics, Herring's law is observed. Herring law is observed in all cases. When we the criteria of chronic case, consideration of criteria is different, but in consideration of the acute cases based on Panchatattva, sir have prepared a chart of acute. When we prescribe on this basis, then you will definitely observe, or we will definitely enjoy the Herring's law in your clinic. So these are the explanations about how sir have invented the chart of acute. Sir have given importance to the activity first, then thermal thrust and mental axis. Here, this chart of acute, first, it is, sir have given importance on the activity, and further the first activity is observed, whether the activity is increased, whether it is decreased, or there is a no change in activity. If there is a activity decrease, then it may be the patient becomes dull, or the patient have a sleep, patient having overpowering sleep, and further the dullness is categorized according to the thermals, and along again it is subdivided according to the thirst. The patient is having the thirsty or thirstless, whether he is chilly or hot. According to these criteria, the chart is again further divided. If patient having a sleep overpowering, then there is a 3 remedies, that is opium, antim-tart and nux mosquita. And in dullness, further categorized according to the thermals, chilly and hot. Again subdivided according to the thirst. If there is a thirstless, then these are all the remedies. If it is thirsty, then these are these remedies. If it is in a patient is hot, and if it is thirstless, following are the remedies taken into consideration. And if it is thirsty, these are the remedies we should be think of. And if activity is increased, then again it is divided into 3 categories, whether the activity is increased at physical level, or whether activity is increased at mental level, or patient is activity is so increased that he becomes loquacious, or he starts singing, And this all comes in the verbals. If it is physically restless, then rule out whether he is hot or chilly. If it is mental restless, then again rule out whether hot and chilly, thirsty or thirstless. And following are the remedies are given under this mental anxiety chart. And in verbal, patient becomes so loquacious, or he start making verses, or he start singing. So all these are comes in verbals. And if patient having a lot of complaints, but his activity, there is no change in his activity remains normal, he does all his works, his daily works is not affected, then it comes under the no change of part of the chart. Then there are 3 remedies: opium, natramur, and silesia. So this is one of the unique book of Sir. This is the unique chart of acute, which gives results in all acute emergencies, not only in acute fevers, but also acute emergencies. It gives wonderful results along with the hearing loss. Sir says that many homeopaths refer their cases to allopathic physicians. The cases belong to the pneumonia, the cases belong to the typhoid, even the malaria. All these cases, they have no dare to deal with such acute emergency, and they referred their cases to allopathic physicians. So why they referred these cases to allopathic physicians? Why they do not deal with these acute emergencies? Because they think that the homeopathic therapy is only for the homeopathic therapy is a slow acting therapy, and it is only for the chronic diseases, and it is not for the emergencies. And even they advise to the patient that just this acute attack should be covered with the allopathic treatment, and if this attack is over, we will prescribe a remedy so that your immunity will be increased, and further attack will not be, you will not suffer from the same further attack in your futures. They give such excuses, and they do not dare to deal with this situation, conditions, or such acute illnesses, or such problems. So these are nothing but the limitations of a homeopath himself, and not the homeopathy. So always says that homeopathy is a complete science. Hence the limitations and the scope is depend only upon the homeopath himself, because he have a limited knowledge, or he have a faulty knowledge. That's why there is a limitations. But we have, sir have shown us a scope of homeopathy, not only in acute typhoid fevers, or a pneumonia, or in viral fevers like dengue, or in corona cases, but even sir have shown a scope in chronic irreversible pathological conditions, even in mentally retarded, physically and mentally challenged children's, even autoimmune diseases, even the cancer cases also. Sir have a huge cure data of all such cases, and because of only sirs, we know the scope of homeopathy. Dr. Henneman have written everything in organon, but I have seen with my eyes only because of the sirs seminars, and because of sirs teaching. Sir have learned. Sir have taught us many things, and sir have opened our eyes. Sir have shown the scope of homeopathy. So these are only because of sir have done, because sir have a huge knowledge of all sciences, not only the homeopathy, but all the civil sciences which is available in the nature. Sir have taken the uses of all these sciences and correlated with homeopathy, correlated with the modern sciences, and shown a scope of homeopathy, show wonderful, miraculous result in all cases. So this is possible if you follow Sir's teaching. Then Sir have a wish that if I show the results and if you follow these teachings, then you have also a wonderful results. You will also enjoy the hearing law in your clinic. So just follow Sir's teachings and you will get a wonderful result. There are many materia medicas have been written on the therapeutic of fevers and the acute diseases, but the still homeopaths do not get the result in acute cases. Why they do not get the results? There are the many reasons, but the main reasons are they do not follow the 7 cardinal principles of homeopathy. They do not consider the law of similia, law of simplex, law of minimum, the drug dynamizations, theory of chronic disease, theory of vital force, and the doctrine of drug proving. They all do not consider while prescribing the remedy, while consideration, while thinking of the patient. They bypass all these cardinal principles, so they do not get the right remedy. And as the remedy do not get the right remedy, they will not observe the Hering's law of cures. So they have limited their practice, or they don't know the scope. So what is the Sir have categorized it as an old concept and no new concept. Why Sir is say that it is old concept? Not only because of the 90% of the doctors uses podophyllum for the diarrhea or aconite of the fever, but they do not consider the right kind of principles while applying the remedies. They apply the wrong principles while prescribing the remedies. That's why Sir says that it is an old concept. And that's why, as they do not follow the cardinal principles, they do not get the results. That's why in society, homeopathy ranks second to the allopathy. It is not first rank to the first rank, because very few people understand the cardinal principles of or the principles of this science, and they apply. And we get a very few homeopaths have a right kind of results. That's why the ratio of allopathic result and homeopathy differs. They definitely do not have a complete cure. We have a cure, they have a suppression, but their position is higher. But when we learn all these principles properly, then definitely homeopathy should be at the first rank, and this is the dream of our Sir. The new concept, Sir said that the new concept which I have proposed here is not actually a new concept, but it is a rejuvenation of the basic tenets of homeopathy as preached by the masters but not understood by many. Sir says that I have not given a new concept, but it is just a rejuvenation of the basic principles of homeopathy, which is preached by preached by Dr. Hahnemann, but not understand of many. I have not done new, but I just rejuvenation of the basic concept of the homeopathy. And by considering all these basic principles, Sir have invented a simple way of arriving the simillimum in acute cases, in acute emergencies, and in very simple way. And that's why Sir have invented the theory of acute, the acute chart for prescribing such kind of acute illnesses and acute emergencies, and without violating the 7 cardinal principles of homeopathy. Means Sir have considered all 7 cardinal principles taken into considerations and made this chart according to the Panchatattva, because man is made up of all these Panchatattva means it forms the constituents of man. While considering the man as a whole and considering the cardinal principles, the medicines will act miraculously and medicine will act holistically, because our principle is man. We do not consider disease to be cure, but we consider man as a whole while creating a man. Now, acute diseases, the wrong application of the knowledge. Acute diseases includes fevers, diarrhea, dysentery, and fevers of typhoid, parasite origin of fever, that is malaria, uh, typhoid, and viral origin, that is of the dengue fever. So these all the cases of acute emergency are treated according to their severity of the diseases, and according most of the physicians are cured with the panic. The mind do not remain stable, they become panic, and they prescribe according to the severity of the disease, and they give the medicines according to the therapeutics, that is for fever they prescribe natramute, ferrum phos, ferromute, 3x, 6x, or for diarrhea they prescribe podophyllum, aloe, all these, and they do not get a right kind of results. Sir have been guilty of that, because in his initial practice, or in his initial years of his practice, sir was doing also the same, and that's why sir felt guilty, and because sir was the part of these such kind of prescriptions. But after reading or after taking all this knowledge, sir have changed his prescriptions. Sir is changed his way of prescription, and sir taught to all over the world how to prescribe holistically. But other physicians prescribe homeopathic medicines but do not consider homeopathic principles. So they prescribe ferrum phos for the fever, 3x or 6x, calimute, natramute, 3x or 6x, or combinations of the belladonna, aconite, ferrum phos, China Rs in 30 potency or the 200 potency, or even they prescribe bacteria, pyrogens, even uses the mother tinctures. The criteria of prescriptions or repetition of the doses depend upon the mood of the physicians. Even some physicians have made some specific formulas for particular disease. For typhoid, they prescribe for particular remedy. For malaria, for acute abdominal pain, they have a formula and they have a result. They claim that we are getting wonderful results, but they are not aware in bargain what they are giving to the patients. Patients, the fever, the abdominal pains or neuralgic pains vanishes, but in return, they give gift of the patient of a weakness, loss of appetite, or even the no desire for works. So these are nothing but the blind prescriptions, and they are not get the satisfactory results. And even the fever goes down, first they prescribe for the fevers. If patient have a fever of 103 degree Fahrenheit today, it will on next day it will decrease up to 1 degree, that is up to 102 degree Fahrenheit, and then on the third, fourth day it will decrease up to 99, and on fifth day it will be normal. The patient feels normal. But the bringing down of fever is certainly not homeopathic results. The fever goes down because acute infection has exhausted of itself and patient cure by himself. But they claim that they have cured the cases, and in bargain they give tremendous weakness, tiredness, having a body pain, muscle pains, bone pains, and even not desire for works. So this is not a homeopathic result. So homeopathic, and even they claim that yes, patient have a weakness because he have a such a high grade fever since 3 or 4 days. So naturally he may feel the weakness, or he may feel weakness because of the loss of fluids, because he was suffering from the diarrhea. So loss of fluid, because of loss of fluids, he feels weakness. So such excuses they give us because they are not aware that what kind of cure should take place. So this is a clear difference between the right kind of homeopathy and the not consideration of the basic principles of homeopathy. When we prescribe a single remedy, single dose, considering the all principles of homeopathy, then what difference we observed? Fever, diarrhea, get fever, diarrhea, or the pains. The fever may be of the bacterial origin, maybe of parasite, that is of typhoid, or of the malaria, or the viral fevers like dengue, or fever due to the corona, or the diarrhea, or the pains. Whatever acute emergency comes in front of us, it should be vanished within the 12 hours, or at most it requires 24 hours. It should not be required more than one day. That is more than 24 hours. It should not be required. Be it is in typhoid. In typhoid, though the Vidal test is positive and having a unit of 350 units, the patient feels better within 24 hours and he resume his duty on the next day. Even the patient is not aware that he was suffering from the typhoid. He forget all these things. He feel energetic. He have a his appetite is not affected. And even in cases of pneumonia, when we advise a patient that do the X-rays, then the pneumonia or the lesion should be disappear within the 3 to 4 days in X-rays. We observed. We many cases have seen that in clinic, even in corona cases also, the with the single dose of Cetija, in initial cases with single dose of Cetija have done wonderful results, and within 2 to 3 days the reports become negative. Even the pneumonic patch becomes there is a complete resolution within 3 to 4 days. And even patient have suffered from urinary tract infections having a percent of more than 100 to 100, or in between the 100 to 200, and it becomes zero within 3 to 4 days. Even the latest antibiotics cannot do such type of wonders or such kind of miracle, but the right kind of homeopathy with a single dose can do such a miracle. It is only possible because of such acute chart. And even with this, when we apply this chart and we prescribe the remedy, we reach to the simillimum, and patient do not feel run down or weak or tired. Even his appetite becomes normal. His appetite do not altered. He have a desire for food, and even he have a stamina to work. Even his relationship with the parents or with the other family members, and even with the friends and in society, and even in workplaces where with his colleagues became sound. After the proper remedy, his relation becomes sound, because health is a state of complete physical, mental, and social well-being. So social is also relation, social well-being is also possible with this remedy. So what is the difference between the old concept and the new concept? In old concept, doctor is not confident of himself, and doctor is not confident of himself as well as the result. What will happen to the next? He will not sure what will be the follow. But according to the new concept, according those who are the predictive doctors, they predict the time, they predict the result, that on the next day, that is on tomorrow at 9 p.m., 9 a.m., you will be completely healthy, you will be completely okay, and you can rejoin your work. So this is the difference between the old concept and the new concept. Along with this, in the old concept, there are the crutches of allopathy required. They need to take the help of allopathic medicine. They need to require, or they need to take the support of allopathic medicines. But in predictive practice, we do not need to crutches of allopathic. No need of allopathic medicine is required. No need of support of medicines. I give example of my son 2 days before he had a high grade fever, and it was increased. It was up to 104, 104.5 degree Fahrenheit, and it was increasing. And after proper remedy, after according to the search chart, we prescribe him, and within 8 hours, he have a perspirations and fever went down. In morning, we prescribe at 5 a.m. 5 a.m. And after 6 to 8 hours, all psoriatic rashes came on his body from head to the feet, all over the body, or the exteriorizations appear. This is the pathological report. We have no need to take the allopathic medicines, or we have no need to take the help of allopathic, even the reports. No need to go to the pathologist. So this is the difference between the old concept and the new concept, that if we prescribe rightly, there is no need of taking the allopathic medicines, also no need of taking the reports also. And in old concept, the cardinal principles are not to be taken into consideration. They only considered the drug dynamizations, but in new concept, all the 7 cardinal principles are taken into the considerations. As they do not, in old concept, do not consider the cardinal principles, so do not reach up to the right remedy and do not observe the Hering's law. But in new concept, according to the sir, Hering law is observed in each and every case. Though patient is suffer from the fever and the cough, coryza should be expected. That is, according to Hering law, it should be within outwards. That is inside to outwards. That is coryza, from cough to coryza. It should be come out, followed by exterior transient itching on the skin. That is, we say that exteriorization. The toxin should be throughout on the body in the form of the mild rash or redness, which should be in a psoriatic form. Now, if patient have a typhoid fever, it should be never expected that after typhoid hair fall should start, which is generally we observed in allopathic treatment. After typhoid treatment, hair fall start. But according to the homeopathic principles, or according to the when we consider the all cardinal prescription, and after the right kind of remedy, hair fall should not be there, because hair fall is an exteriorization. Because what is typhoid? Typhoid is nothing but the enteritis, that is the infection of the inflammation of the intestine, So which system is to be affected here? Here the gastrointestinal system is affected. So according to the embryologically, this is the second layer. First is the skin and second is the all respiratory system, gastrointestinal should be considered in the second layer, that is at the endoderm level. And hair fall is which it comes in which layer? Because though hair fall, we see that it is on the outer part of the body, but the origin of the hairs, but the root of the hair are embedded in the mesoderm. So here the disease proceed upward from the lower side to the higher sides, which is deeper in origin, and most important, the disease proceeds from the endoderm to the mesoderm. So disease is increases his steps. So this is a sign of suppressions. So this is not a welcome sign. After typhoid, the hair fall should not be a welcome sign. Even after diarrhea or the dysentery, if joint pain start, is it the right direction? No, it is not a right direction, because in diarrhea or dysentery also, here also the gastrointestinal tract is involved, which is the second layer of the embryologically second layer of origin, that is of the endoderm. And joint pains are nothing but the inflammations of the synovial membrane or the bursas, and so they are of the mesodermal in origin. They are scleroderm of mesoderms. So they are of connective tissue. They are made up of joint pains are included in connective tissue, but originated is in embryologically a mesoderm level is involved. So again here the disease is progress from the endoderm to mesoderm, that is of higher level diseases progress. So this is also here in this case is not a welcome sign. So here the joint pains after dysentery is a suppression. Here same thing is given in this slide. Alopecia after typhoid is suppressions. Hence backache or joint pains after typhoid or dysentery is a suppression. These are not the welcome signs after the proper remedy. And sir also says that in each and every acute cases, hearing law is must. You must observe hearing's law. If law is not observed, if you are not enjoying the hearing's law, then you are somewhere wrong. You are wrong in some applications of 7 cardinal principles. You are wrong somewhere in the cardinal principles. So you have to check where you have to wrong. You have to reconsider the case and prescribe again if hearing law is not observed. Then there is an indication, and this is a test. Hearing law is our test. We show that whether you are going in the right direction or the wrong direction. Hearing law guides us whether the complete cure is occurring or the not. Now, acute illnesses. So, what is acute illness? By the acute illnesses means there is a temporary disturbances in the health, but in a negative way. There is altered in a change of health. There is altered in a state of health at both mind level as well as physical level. So there are 3 types of acute illnesses, that is acute inflammation, acute infections or pain. This is first type. Second is acute exacerbation of the chronic, and third is the indispositions. So acute illnesses are categories in 3 ways. In acute illnesses, all types of fevers, even acute abdominal pain, ulcerative colitis pain, neuralgic pain, any infections, that is bacterial, viral, or parasite, all are included in these acute infections. Acute illnesses are of three types. First is the non-recurring acute infections, that is acute diarrhea, acute dysentery, high fever, fever of bacterial origin, parasite origin, that is of the malaria or the typhoid fevers, and the viral fevers, dengue fevers, or nowadays we are dealing with the corona cases, and there is a high grade fever along with the respiratory distress. So these are comes in acute emergencies. Along with this, pneumonia, there is a pleuritis, there is a lung abscess, there is a pleurisy, there is a urinary tract infections. So all these are the acute emergencies, acute complaints, and for this, the way of treatment is what? Here we required acute remedy for recover of this remedy. We do not prescribe on genetic constitutional. We do not give GCS to the patient. We required only acute remedy for this case. For example, if patient GCS is opium, then he required a remedy. Remember, one thing is that if patient having a opium as a GCS, then he required a remedy in relationship with that GCS. If opium is his genetic constitution, then in acute cases, he required a remedy in relation to the opium. Then which are the remedies in relation with the opium? It may be of the aconite, it may be of the belladonna, it may be of the antimtat, nux vomica, nux mosquita. All these are the remedies which are in relationship with the opium, and among you have to consider the cause, you have to consider the activity, you have to take in consideration of the thermal thirst and prescribe the remedy which is in relationship with the GCS. So these are the criteria while curing the acute infections, acute inflammations, or acute emergencies. And in cases of acute exacerbation of chronic, means there is an increase in intensity of the acute conditions, acute illnesses, and here we do not prescribe the acute remedies, do not follow the acute chart here. The acute chart will not help here. Acute chart will not do wonder in these cases. Here we required a genetic constitutional minimum remedy. If we here required genetic constitutional minimum, if we prescribe on the basis of the acute, or we prescribe on the basis of the acute chart, then the patient will feel better for some time. It will have a temporary relief of the complaints, but rather there is an increase of the disease, and it may go to the higher level. Then so this is if patient disease is going to the higher level, so this is the sign of the suppressions. So always remember that in that cases we require a genetic constitutional minimum. We do not require the acute remedy here. And third criteria of the acute illnesses is the indispositions. Like patient wets in the rain and he suffers from the coryza. Also, patient have a gastric upset due to the overeating or due to the taking of high rich food. He may suffer from the diarrhea. He maybe suffer from the vomiting. At that time, you have no need to take consideration as a acute chart, or you have no need of prescribing the remedy as an acute remedy or any kind of remedy. You have no need to do, because these diseases are the self-limiting diseases and the cure of its own. So these are the criteria which sir have shown, which we daily face in your clinic, in our clinics. And when you prescribe, and another more important thing is that in acute cases, most important point is to be remembered. You have to consider first the cause of the disease. Then we have to consider the activity, whether the patient is dull, whether patient's activity is decreased, or patient having a no change. Then consider the thermal axis, and then the thirst. Mental axis means cause, change disposition, you have to consider here. And all these, when you combine all these, when you prescribe on this basis, because this axis is based on Panchatattva, and a man is made up of Panchatattva. So we all considered here, we consider the constituent of the man. And when we consider the constituent as a whole, when we consider the man as a whole, then you will definitely get results, and you will definitely follow the Hering law, which is the right kind of homeopathy. And when you give such a results and you feel satisfied that you are giving uh, judgment to the case, and you will be happy, patient will also happy, even your confidence will increase. When you first prescribe the cases, first deal initial, those who are the newcomers deal only with the acute cases, and when you show wonderful results in such cases, you will get, your confidence will increase, and even the confidence of the patient on you will be increased. So thank to sir, that sir have given such a kind of unique book for us, and such a kind of chart for us. And by this chart, we reach to the simulum with less efforts and wonderful miraculous results observed. So thanks to sirs, and thanks to all of you for patient hearing, and thanks to Predictive Homeopathy for giving me a chance to explain sir's theory. Thank you very much. Here today I stop my lecture.